internal rotation. Is that all right with you?
Mm-hmm. We're not going to try.
Oh, no.
We're going to be victorious.
We're going to try.
Okay, so measure that side.
That side? Cool, cool, cool. All right, so I'm just going to put your arm on this towel here. Straight out. Just going to have you relax there. Passive or active?
I would like to see passive, actually, since you're here.
Right. Okay. So I am just going to have you...
So before you put the goni on.
True. Internal, right?
Yeah.
Okay. So I'm just going to push down on this. Wow, you have a lot more than I did. Oh my God.
Okay, good. So that's where you want her hand. Are you happy with where her humerus is?
No,
Okay.
I'm not. Now I am. Happier.
Good use of cues. Perfect.
Good.
Okay. So what kind of end feel do you think there is?
I don't remember the end feels. I know it's not muscle.
Okay. So for those of you who are watching, can you tell what the end feel is by the bounce?
Capsular.
Capsular.
Perfect. Thanks, guys.
Okay.
All right, we'll try again.
It takes a village.
Sorry,
I'm in a weird mood today more than usual. I don't know.
Sorry, Aubrey.
And that looks about right.
Is your vertical arm vertical?
It looks like it's.
Oh, there it
There it
is.
is.
And is her shoulder, front of her shoulder down where you'd like it? I know, there's a lot.
How do you hold the shoulder and
There you go.
goni?
There you go.
Okay. So 83 degrees.
Okay.
0 to 83.
Okay, so let's maybe not leave her there. There you go. Very common. It's not a problem. So
What?
0 to 83 degrees
Yeah.
with a capsular end feel.
Sure.
Perfect.
Seems right to me.
All right. Does anyone know what normal is for internal rotation?
Isn't it
You got
70?
70.
Oh.
So 0 to 70. Okay. So you
Surpassing the
exceed
norm.
expectations. Okay. So let's do a deduction. I'm gonna have you do all the hard ones. Can you do a abduction?
I can do AB duction.
Okay, a deduction is the same but different.
Well, you said you don't even measure AD duction.
No, I don't. Have you ever measured a deduction?
Not for shoulder.
Cool.
Let's learn it
Exciting.
anyway.
Exciting. Passive or active?
Active.
Oh, nice. That's easier.
So,
Talk to her, Ken.
You want to do some adduction for me?
Yeah, what is that?
Yeah, can I just have you bring your arm across your body while I measure how far you can bring it?
Perfect. Oh my god.
What the?
Oh,
Is
gets a
that,
taste of his
is
own
that
medicine.
legit?
that's
No, I'm
it's not.
cheating. But you just said bring my arm across my body.
There you go.
way to play
Wow.
dumb.
I have a quick
Wow,
question.
you are the
In general, for abduction,
because you don't help.
flexion, extension, is it okay if the elbow flexes at all?
Yes.
That about right?
Looks good. Yes. I would go up there, but I don't think it'll affect your.
Yeah, it does
Yeah.
a little bit.
Okay.
So you can rest your arm back down.
So his axis was a little bit low. If you were using your X-ray vision to see where the joint was, so I just moved it up a little bit, but then that changed where it was bisecting.
23 degrees.
23
Active
degrees.
rotation.
And what's the norm for
Or
adduction?
active adduction. There's no
There
norm.
are no norms. Awesome.
Boom.
All right.
Comment on what Gabe was saying a second ago. When we're doing goniometry, we're specifically not doing muscle length testing, so you don't want those two joint muscles getting in the way with the goniometry element.
Right.
That's for muscle length testing.
We will go out of our way to actually put the two joint muscles on slack for goniometry so that we are able to get capsular infills. And
So someone's doing pass range motion abduction, and they get up here, and then they can just.
sure, it should not affect their range of motion.
Okay.
Okay. All right, so we're gonna do extension. So I'm gonna have you flip over, Amy.
Oh, perfect. Then you have to tell her. You'll set her up for me?
Yes.
I just gotta do it?
Yep. Have
Nice.
your feet out, hanging off the edge for me. Okay. Put your forehead there. Is that rolled up high enough, or is your nose getting smushed? Oh, it looks almost perfect. Okay. Do what you're on.
Passive or active?
Active.
Oh, yes, I like active. It's easy. So, Amy, I'm just gonna have you bring your hand straight back as far as you can, okay? Yeah.
Oh, that's pretty good.
More than pretty good. That's freaky. Okay, so get
You
up
can
to the
rest now.
acromion. Get your gonium closer to the acromion
let's
for your
try that.
axis.
So here?
Yeah.
Does it matter which direction
Oh,
they're
that
headed?
changes it quite a bit.
Excuse me?
Does it matter which direction they're headed?
Alright, you can rest now.
Thank you.
So
33.
it looked like your stationary arm was up just a little bit, so I think that could have come down a little bit to
Okay.
really bisect her torso a little bit.
Okay.
What number did you get?
33.
All right.
I have a question. Even for active range of motion of the shoulder, would you want the patient to go through 2 times shoulder extension there?
Good question. So this is an incomplete picture of what we're doing right now. What you're gonna learn in the fall is you're gonna do a range of motion screen. So you will have already had the patient do the range of motion Macarena. Okay? So you're gonna have them come up, out, behind their head, cross. Okay? You will have them have done that, and so you will know what their range of motion looks like. So you will know whether or not what they're going to have for their extension, so you wouldn't necessarily need to do it twice, especially if it was a motion that was painful.
Well, also, aren't you supposed to do prom first? So if you do prom first, you do capsular, or you do the end peel first, then you do prom, and then you do active.
Yes.
So they would be taken through the motion twice before you even do active.
Sure. Good thinking. The person in a slightly posterior pelvic tilt, which is the opposite direction where they're going to tend to go. Okay. So for the latissimus dorsi, excuse me, normally we will do it both arms at the same time. And so, what I'm going to have you do is, so what does the latissimus dorsi do? Did you guys?
Internal rotation, extension, adduction.
Extension, adduction, and a little bit of rotation.
Some
Right.
coughing.
So if we're gonna what?
Some coughing.
Like coffee. So if we're going to measure the length of the lats, what are the directions we're going to want to go? Flexion, external rotation,
AB.
and abduction. Okay, so we're going to use gravity for this one. So after I just emphatically said that all muscle length tests are passive, this is one that you typically just ask them to do and let them hang there. Okay, so what I'm gonna have you do is just go ahead and bring your arms up overhead and just let them keep going. Yeah. She's a little bit up here. So I'm gonna have you come, just bring your arms here. I'm gonna have you push your back into my hand. There you go. Oh, you don't like
Sorry,
that.
I maybe should stand.
Ah, okay, go ahead and come back. So she's not cheating, she just is hyperlordotic. So how you would measure this one is you're gonna be measuring the distance between the arm and the table, okay? So typically, we haven't covered the landmarks of the elbow, but you've got a medial and lateral epicondyle of your humerus. And so for a lot of these, you're gonna be measuring from the lateral epicondyle to the table. Okay, so you palpate, it's gonna be there, and you're measuring this distance.
Why do you want them posteriorly?
Because what is the attachment for the lat?
Oh, on the iliac crest.
Yeah, and so if you let them go into hyperlordosis, you're shortening the muscle here, which will give you
Okay.
more range of motion here.
Okay.
So just like we talked about 2 joint muscles, you're actually wanting to get that maximally lengthened here and then measure the
Okay.
motion up there, okay? So with your tape measure, everything's going to be in centimeters and not in inches, okay? So then we're gonna come in. So what I do is I find my structure, I put my thumb on the 0, and then I bring my index finger down, okay, like this, so I get that distance. Then I can pull it out and read it, if I had my glasses on. So it's 2.6 centimeters.
And are you cool with her wrist and forearm sitting on the table for this measurement?
Yeah, because if it was the table that was the problem, she could have her arms straighter. So she's resting there, and so that's okay. So again, the lats don't cross the elbow, so I don't really care what the elbow does.
Oh, I meant more in
Okay.
terms of just like
If she had more available
she's like
range.
running into something.
If she had more range, she would be able to straighten out and get further. So I don't think that's what's limiting her. Okay? Does everyone understand Dr. Bryant's question? If you thought it was soft tissue that was limiting, you could actually move her up, okay, so that her forearms were coming off the table. Because what you need to know is this distance, not a distance down here. Okay? All right. You can come on back down. Sorry, I left you up there for quite a while. I think if we go into the pecs. Yeah. Okay. So, yes, Jess.
So for the shoulder skills, it asks for norms for muscle length testing.
Right.
So what are we looking for?
So
that?
0.
0.
Yeah. Thank you for saying that. Okay, so now the next one is for the general pec, you just have the person put their hands behind their head. Let's go ahead and just put your hands behind the head. And you're looking at the distance of the olecranon to the table. Now this gets to be a little bit tricky because there's no more room for her to go, right? She's down on the table even though her olecranon is not touched. So the tip of the olecranon is not touching the table, that would be a distance. But that distance, there's soft tissue there. There's no way the olecranon could truly touch the table. And so in that situation, I would just put negative, meaning that she doesn't have a length issue. Instead of, because it's not really 0, but to measure that, it wouldn't make sense, okay? If she had tight pecs, her arm would be like this, okay? So then we would measure that distance. And you're just going perpendicular to the table, okay? Now so that's general. Now for clavicular, what is the orientation of the fibers? Hayden, I feel like, come join us. How about right here? Put my back to you, I don't like it. So clavicular fibers of the pec, they're pretty horizontal. So if we want to maximally lengthen those fibers, what position do we want the arm to be in? Yeah, so we're going to go right out at 90 degrees. You can go ahead and relax that arm. Straighten out your elbow. So we're going to come and just go straight out. We're going to measure that. I'm going to bend her elbow because it's freaky to watch that. So again, we're measuring lateral epicondyle to the table. And she obviously has no length issues. Okay? So this is going to be the clavicular portion of the pec major. Now, if we come up, we're going to go to 135. Okay? Now, 135 is just a 45-degree angle off of 90, right? So we're going to go to 145 and have her straighten out her arm. That's going to be what part of the pec major? Sternal. The sternal. Okay? It's the same measure, lateral epicondyle to the table. Again, if soft tissue is what's limiting it, you would just put negative in parentheses. Okay? So we have pec major general, we have pec major clavicular, pec major sternal, okay? And then we had lats. So we've covered 4, but they're all pretty easy, right? Okay, so the next one is pec minor. Pec minor, you just have the person lay on the table, okay? Arms are flat, they're just laying there. You're gonna measure posterior acromion to the table. So here, she has a little bit of tightness, okay? And how I know that is I could push her down further, so I know that it's her pec that's tight. Okay?
Should you always test that, like signal the push?
Yeah, because for some of the others of you, you may be in that position, but it's because there's soft tissue that's limiting you going back, so you need to know that it's not that, and that it's truly that it's anterior tightness. Okay? So again, you're going to find that acromion, and then you're going to measure that distance perpendicular to the table. Okay? So I'm going to show you one more. Then what's after that? Is it biceps, triceps? Can you go one more? Yeah. And then one more? And is that it? Yeah. Okay. So we've almost done all the muscle length tests. Okay? So we talked yesterday in anatomy class that we were going to talk about the differential for the 3 muscles that attach to the coracoid process, right? So when we're in this position, it could be all 3 muscles that are contributing to that protracted position, okay? So if we want to rule out biceps is a 2-joint muscle, okay? And we have our arms straight on the table. What could we do to put slack in the biceps? Flex the elbow. So what we're going to do is flex the elbow and see if this goes down. And I don't think it did. Did anyone see? Because Amy is a little bit tight. It didn't go down at all. So biceps are not contributing to her length issue in the front of her shoulder. Okay? The next muscle we're going to rule out is the coracobrachialis. Right? So if we wanted to shorten the coracobrachialis, what does the coracobrachialis do? It adducts and flexes. Okay? So if we wanted to shorten it, we're going to do those actions, but we're doing it passively, right? So I'm going to flex her shoulder just a little bit and bring it in a little bit, but you don't want to come up any higher than this. Because if I bring her up really far, what happens to their posterior acromion? I'm driving it into the table and it has nothing to do with length. So it's really important when you're doing the differential that you're really only pulling it a few inches off the table. Okay? Now, I don't think that it moved there either. Okay? So if it did change, then I would want to take that measurement. Okay? If it was still not 0, or if I still felt like it wasn't soft tissue, the remaining tightness would have to be because of the pec minor, because I've shortened the other 2 muscles that attach. Okay?
And on that note about maybe a little, sometimes it is easier to just feel on the anterior shoulder for changes in pressure pushing up into your hand than it is to visually see the difference.
Yeah, and I wouldn't be looking, I was only asking you all to look, but I would be palpating for a change in that tension. And if there is a change, then I would want to measure that.
You mean changing tension for the muscles that you just shortened?
So I would have my hand here. Go ahead and relax one. Let me stretch them away. So I would flex her. Nothing changed because there's tension that's holding her up, right? And then once I have her here, I'm still feeling, and now I'm gonna flex her and adduct her a little bit, and I'm still feeling no change. There is a little bit of change, and if there were, then I would want to measure that. Okay. Because then the remaining of that would be pec minor. So in my example in the documentation notes that I now dictated like 27,000 times, there's actually an example of documenting this particular test. And it goes from 5.6 to 3.1. So that person still has some tightness left in the pec minor. Okay? So does everyone understand pec minor and the differential? Okay. Why don't we have you go do that, lengthen the elbow, biceps at the elbow, and measure the shoulder. We've not covered how to measure the elbow yet. We'll be doing that on Tuesday, but it is not rocket science. You bisect the segments, make sure the axis is at the crease, and you're good to go. So for the first one, if we're going to maximally lengthen at the shoulder, I'm going to have you kind of like sideways. There you go. Perfect. Okay. So again, this is a passive test. So with her elbow bent, because I don't want to be lengthening the biceps here, I'm maximally extending her shoulder. Okay? Then what I'm going to do is once I'm in this position, I'm going to straighten her elbow and see how much, keeping that shoulder extension, I'm seeing how far I can extend her elbow. I can get her elbow all the way extended, so that would be 0, and that would be normal. Okay? Now, the other way I can do the test is to maximally lengthen the biceps at the elbow. So I'm going to pronate and extend, and now I'm going to drop the arm down. Now we're going to measure this just like we would for shoulder extension the Chidi way. Okay, and relax. Okay, and I'm going this way, so I've got 68 degrees. So I would not document 0 to 68 because this is a length test. I would just document 68 degrees of shoulder extension. Okay? So if I was going to document that last one, I would have muscle length test, right biceps, and then in parentheses, I would say shoulder extension, and I'd say 68 degrees. Okay? The first way, I didn't actually put a goni on her elbow because I could feel that she was all the way straight. I can do that. We can pretend that you weren't. So I'm maximally extending her shoulder. You've got just a boatload of extension in your shoulder. Which one of you is pick me upping over there? All right, so then for measuring her extension, so if we said that was all she had, the elbow is a little bit goofy because she's lacking extension, right? You can see that. So she would be negative 22 degrees because this would be 0 extension, and she was lacking 22 degrees. So when I documented that, I would say biceps, and then in parentheses, I would say elbow extension, and it would be negative, what did I just say, 21 degrees. Okay? So for extension, she doesn't get to 0. She's lacking that motion, so it would be a negative number, which is our first time we've had a negative number. Okay, we'll see the same for the knee. All right? So does everyone understand the 2 different ways you can measure biceps? All right.
So those are 2 different measurements, or are they technically measuring the same thing?
They're both measuring the length of the biceps.
Okay.
So you should, and how you know what the norms are is that it's the norms for the goniometric measurement for that joint that you measured. So normal for elbow extension is 0. So the norm for the biceps test, if you're measuring the elbow, should be 0. What do we know the norm to be for the shoulder? For extension, sorry, I wasn't very clear. 60.
Yeah.
60. So if she has more than 60, then that would not be a limitation because of her biceps. Okay, so the norms for the length tests are going to be the same as the range of motion for goniometry for these 2 joint muscles. Okay, so I would not do both of these biceps tests in the same person.
Okay.
So you would choose which one you wanted to do based on the person's symptoms. Okay, so if I was already measuring shoulder and then having it on the elbow, if I was already measuring elbow stuff for other reasons, I would probably do the length test at the elbow as well because I've already had those other measurements to compare it to. Likewise, if I had measured shoulder extension before, I would probably do shoulder extension here because I'd be able to interpret those data a little bit better. Okay? Now, for triceps, the same thing is true. Sorry,
You're good.
So what does the triceps do at the shoulder? Extends. And what does it do at the elbow? Extends. So we're going to be flexing at both of those joints. Now, we again have a choice. We can maximally flex her at the shoulder and then flex her elbow and take that measurement, or we can maximally flex her at the elbow and then measure shoulder flexion. Okay? But remember, for a 2-joint muscle, the trick to think about is we're going to maximally lengthen it at one joint. So we're going to go the opposite the direction of the action of the muscle. And then we're going to measure the length going the direction, the opposite of the action of the muscle at the second joint. So if we maximally flex here, so we're lengthening the triceps around the elbow, and then I pull her into shoulder flexion. Now we're running into a problem with her hand. So can we have you go angled at the table a little bit more? Can you scoot your, there you go. Yeah, let's keep your head a little bit closer in. So I bring her back. Now I can measure her shoulder flexion. Okay. Oops, I moved my goatee, sorry. Okay. And so for flexion, she had 134 degrees. Okay. Now my guess is that she has more than 130, I'm going to talk about you in the third person, that she has more than 134 degrees of shoulder flexion. So my guess is she does have some tightness in her triceps. Okay. Now the other way is a little bit harder to measure for triceps. So now I've maximally flexed her, and now I'm going to measure flexion of her elbow, and that gets tricky because we all have these big noggins on our head, right? So for this one, that gets harder to measure, and so it's easier if you measure shoulder flexion by doing it here, but you can do it both ways. So let's have you go ahead and do those two tests. Deltoid. So for all of the deltoids, the primary action is abduction for all three of the muscle groups of the deltoid, right? So we're going to do the same active range of motion against gravity for all of them. So, John, I'm going to test your right arm, okay? So what I'd like you to do is just do what I do. So I'm going to have you bring your arm all the way up and all the way down, okay? He has full active range of motion against gravity. If he stopped short, I would need to know what his passive range of motion is to know if that's his full available range, right? And that's why we do strength testing after we do range of motion testing, is to help answer that question. So because he has full active range of motion against gravity, what I'm going to have you do now is I'm going to have you come up to this position. There you go. And just hold it there. Do you have any problems there? So this is the test position for the middle delt. Okay, so now what I'm going to do is I'm going to come behind you here. I'm going to push down, and I want you to not let me move you. Okay, so you're going to hold that position. Are you ready?
Mhm.
And relax. Good. And you can go ahead and relax your arm. So I would give him a 5 out of 5. Now, because I'm so weak, and particularly weak in my right arm, don't nod. I would be much better off testing him in a chair so that I have leverage. But I'm trying to apply resistance at shoulder height with an arm that isn't very strong. Okay? So I would be better off testing him in a chair. The rest of you wouldn't have that problem. Now, if I had him...
I have a question. Does the other hand matter?
So he was worried about how much resistance I was going to give him, so he was bracing. I was watching to see if he shifted his weight, and I didn't see him shift his weight at all, so he's okay.
Got it.
Okay?
If they do shift their
he
weight,
was-
would that lower their score?
Excuse me?
If they do shift their weight, would that lower their
I
score?
know I would redo the test.
Oh, okay.
I would redo the test. So yeah, he overestimated my...
He's really good at it.
So,
Just like hit 'em.
so if I put him in the test position, so if we went all the way up and then I put him in the test position and he was able to hold the test position, so go ahead and go back in that position. And as soon as I applied resistance, his arm fell, he would get a 3+ out of 5. If he wasn't able to hold the test position, but he had full active range of motion, he would get a 3 out of 5. Okay? So now we're going to do a scenario where you don't get a 3 out of 5. Okay, so do you know what you have to do when you act? All right, so I'm going to have you bring your arm all the way up. Oh,
That's it?
you don't have full active range of motion. Now we would need to know that his passive range of motion was farther than that, right? We would need to know that, because if that was what he had for passive range of motion, we would go ahead and continue with the test. But we're going to say in this scenario that wasn't. So John, I'm going to have you go ahead and do is lie down on your back with your head at that end. Okay. So, are you comfortable? You're kind of one of those people. So I'm going to have you lead with your thumb, and what I want you to do is make a snow angel for me. So the same motion you did before, but I want to see if you have full range of motion. Can you go? There you go. Ta-da! He has full range of motion. So now he's a 2 or higher. So now I'm going to put him in mid-range. So John, what I want you to do is that same thing. You're going to try to move your arm up next to your ear, and I'm not going to let you, okay? So go ahead and pull up. There you go. And relax. They're saying you're strong, not me. So he was able to take resistance in this position, so he would get a 2+ out of 5, okay? Because he had full range against gravity, and he was able to take resistance. Now this time you're gonna not have full active range of motion. So John, what I want you to do is make that snow angel again for me. Good. Now are you able to go any further than that? Okay. All right. So now he has partial range of motion, so he's going to get, but he did move, so he's going to get a 2-, and I'm not going to apply any resistance. Copacetic? Okay. Yeah.
How do you get a 3-?
A 3- is if he were here, he had full range of motion, and I was, and he was able to give me that much resistance, but for whatever reason doesn't have full range of motion. The other way that you can get it is if you're looking at his full active range of motion against gravity, and he's almost there but not quite, you might give him a 3- in that case too. Okay? All right. So now in the next scenario, when I had him stand and ask him to abduct, he wasn't able to lift his arm at all. So then we went here, and now John, I'd like you to bring your arm up, but don't move it at all. And it doesn't come out at all. So now he cannot get a 2 or even a 2- because there's no movement of his arm. So now I'm going to palpate his deltoid, and this is where palpation of the muscle bellies is important. It's not relaxed. So now I'm palpating here. I'm actually going to give him a little bit of resistance with my other hand. I want you to push out into my hand, okay? Go ahead and push out. Oh, and the muscle is contracting, right? And relax. So now he gets a 1. Now the reason I'm giving him something to push against is sometimes it's hard for people who have strength that's that low. They don't have the motor control to understand what you're asking them. And with some resistance, that it will give them more of a cue that you want them to push out, okay? Now, for a 0, I would palpate here, I would ask him to push out, there would be no movement, and I couldn't feel a contraction. Okay?
Could you have a 1+ or a 1-?
No.
So we don't mess around with those below 2?
No. So you have the 2-, a 2- is quite variable. He could move just a little, or he could move almost the full range, and those are all 2-. Okay? But if he moves at all, it's in the 2 range, and if he doesn't move at all but the muscle contracts, that is a 1. Okay? All right, I'm going to have you sit back up again for me. So that was for middle delt, or the general delt. We can also test the anterior and posterior delt. Now the deltoid is a 1-joint muscle, so according to Kendall, what is the optimal test position of a 1-joint muscle? For those of you who watched the video.
No, like mid-range.
Okay, we've covered the gamut except for the right answer. So you want it maximally shortened for a 1-joint muscle. So if it's delt,
What was it for a 2-joint?
mid-range.
Oh.
So I'm actually going to scoot down to the end here. There you go.
So anterior delt and posterior delt are both Kendall class 1s.
So I don't remember the classes, but they're short.
Sure. Okay.
Short 1-joint muscles. Okay? All right. So similar to what we had for middle delt, where we just brought it here, we want to shorten those anterior fibers. Okay? So to do that, how I think of it is we want to get those fibers to be perpendicular to gravity. So we're going to bring him back a little bit and up a little bit. Okay? Sorry, we're going to bring you forward, but and then up a little bit. Right there. Now can you hold it there? Okay, so he's at least a 3+. I'm still going to push mostly down and a little bit forward. Actually, I'm sorry. Push forward and down. Okay, got me on that question. Okay, we're going that way, and I'm going to hold for 6 seconds. Go ahead and relax. If on his general delt test, he didn't have full active range of motion against gravity, I wouldn't do any of these delt tests, right? Because they all are based off the premise that he has full active available range of motion against gravity, and all 3 tests require the same primary motion. Okay. Now for posterior, same position, except now we're going to drop down and back a little bit, and now I'm going to push. I'm going to pull this way. Okay, ready? And relax. Okay? So I'm going to have you all practice. Okay? So we don't do supraspinatus tests or empty can tests for supraspinatus strength. So what is the primary action of the supraspinatus? A reduction. So we're going to do the exact same active range of motion test that we did for the delt. So if the person is unable to do it for the deltoid, you wouldn't start over again for supraspinatus. You wouldn't test the supraspinatus because it would look the same. Right? Everyone following that logic? All right, Michael, so I'm going to test your right arm again. Oh, gosh. All right, so go ahead and have you come all the way up. Good, and back down. and it looked like you had no problems with that, correct? So we're gonna go ahead and have you get in the test position. So what I'm gonna have you do is bring your arm up, there you go, and now what I want you to do is bring your wrist up. So this is very similar to the position for the anterior delt, except that we're keeping the arm in true abduction, okay? Now, what we wanna do is eliminate the upper trapezius from this test because we're gonna be resisting that abduction. So we wanna shorten the upper trap. So what I'm gonna have you do is tilt your head that way. Good, okay. So he can maintain this test position, and so he would get a 3+, right? Now this test is complicated because we're going to resist in 2 directions. I'm going to be resisting abduction. I'm also going to be resisting the lateral rotation. Okay, so there's 2 parts. Are you getting tired of being in that position? Okay, so there you go. Okay, hold it there. Breathe. Me or him? And relax. Okay? Now, you're resisting the abduction and the lateral rotation, but you're still giving 1 manual muscle test grade. Okay, so it's not like this is a 5 and this is a 4, or vice versa. They're going together. Now, you're going to need to play with it and get feedback from your patient to see that they can feel that difference. Okay, that you're both resisting the abduction and the rotation. Now, what if he didn't have full abduction? What about the gravity eliminated? So the 3 down. It's exactly like what we did before, right? I said that earlier, but remember that, okay? The next manual muscle test we're going to do is actually for the upper trapezius. So what is the primary action of the upper trapezius? It's elevation, okay? So, yep, just go ahead and elevate. I don't know what it is. Okay, so then what we want to do is, it's again a 1 joint muscle, so we're going to want to have that muscle maximally shortened to test it. So what I'm going to have you do is bring your ear down to your shoulder and your shoulder up to your ear, and then I'm going to have you look away just a little bit. Now what I'm going to do is come in and try to separate your head and your shoulder from your shoulder. How about that? So scary. So hold it there and don't let me separate them. And relax. That was me shaking, not him. Again, that's a really bad height for me because it's at shoulder height. And so that's something that I would want to test down here because I'm going to be a lot stronger here than I am going to be here. Okay? What's the next one? Hoity boity. Okay, we'll have you go do those. Good? So manual muscle testing is probably one of the more aggressive things we do, and you can hurt someone if you push too hard or for too long. Tanner, did Catherine hurt you?
No.
She's over here smiling and you're over there sleeping. Okay, so serratus anterior is a tricky one. Actually, Ryan, let me scoot down here. Sorry, just stay sitting. So what is the primary action of the serratus anterior? So it's going to be protraction. So what I'm going to do is with my left hand, I'm going to be monitoring Ryan's scapula, and I'm going to have you go ahead and make a fist. And what I want you to do is just punch forward without moving your body. So I get real nice protraction. Good. And you can go ahead and relax. Okay? Now, what would gravity eliminated be if he couldn't do that in sitting?
Prone with his arm off the table.
No.
So I would put him in sideline.
Oh, yeah.
Right?
Lying on the opposite side of the
Yeah,
affected arm.
I would put him sideline and have him punch forward, but I would be supporting the arm. So let's go ahead and show that. Go ahead and go sideline. Let's put this under your head because I'm a slacker and didn't get you a pillow. Okay, now go ahead and punch forward. Do you see how that's gravity is perpendicular to the motion? Okay, all right, so let's go ahead and have you sit up. So this is another one that requires you to resist in 2 different places. So I'm going to be pushing on the lateral border of his scapula, okay? Because I am going to be resisting that protraction. So all of you on that side of the room are not going to be able to see that force. The other place that I'm going to apply force is going to be I'm going to be resisting the shoulder flexion, okay? So I'm going to have you go ahead and get back in that test position. I'm going to have you go ahead and punch forward for me. Now I want you to hold it there. I'm going to be pushing here and pushing down. You don't let me move you, okay, in either place. Ready?
Yep.
Here we go. And relax. Oop, there went my elbow. Good job. Okay. So I'm resisting the protraction of his scapula and I'm resisting shoulder flexion. Okay. Now, Coracobrachialis is the next one, right? So what's the primary action of the Coracobrachialis? Shoulder flexion. Okay. So what I'm going to have you do is go ahead and bring your arms straight up. Looks good. Now, what if he couldn't do that? What position am I going to put him in? Sideline. Good. Great, you guys. That's good. So he could do that. So now I'm going to have you get in the test position. Now, what is another shoulder flexor that's a two-joint muscle? Biceps. I want to get rid of biceps and try to test only coracobrachialis. What is the principle that I can apply that will cause biceps to not be able to contract very well? If it's a two-joint muscle, I'm going to shorten it by flexing the elbow, and I'm creating active insufficiency. Okay? So I'm using active insufficiency of the biceps to try to get it out of this one. So remember, one of the questions you're going to be asked is, how are we isolating that muscle? Here we are isolating coracobrachialis from biceps by creating active insufficiency of the biceps. For a two-joint muscle, it's going to create the maximum force at mid-range. So our two strategies are to either maximally lengthen a muscle or maximally shorten it to get it to not contribute as much. Okay? In this case, maximal lengthening is not active insufficiency, only maximally shortening. Okay? So what I'm going to have you do is I'm going to have you bring it in and then tuck your elbow in a little bit. There you go. He has no problem with that, so what grade does he get? 3 plus. Okay, because he can hold the test position. Now I'm going to stabilize here, and you hold it there and don't let me pull you down, okay? And relax. So what I'm doing is pulling him out of flexion and adduction. I'm pulling him into extension and abduction. Okay? Now I'm also, notice that I'm not grabbing him across his elbow and compressing his elbow. I'm coming in here to do that pressure. I'm also not applying that pressure across his elbow. I'm doing it all up here, so I'm not creating any torque across his elbow. Okay? Are the pecs the next one?
Yes.
Okay. Pecs are easy, so I would like to show you those, and then we'll go with those 5. So I'm going to have you lie down on your back for me, please. Okay, so we're going to have, I think it'll be easier for everyone to see if I test this side. So we're going to break the pec major into its 2 component parts again. So the sternal and the clavicular, excuse me. So for the clavicular portion, what I'm going to have you do is start in that position, and all I want you to do is bring your arm across your body. Go ahead. Great, and come on back. Now, if he couldn't do that, what would be the gravity eliminated position? This one's a little trickier. Sitting, great. So it's going to be in this position because now gravity is operating this way. Now if he was in that position, I would be supporting his arm. He doesn't have to hold his arm up. He just needs to move in that direction. Okay? So now for the test, I'm going to put him here. I'm going to stabilize the other shoulder. I'm going to have you hold it there. Don't let me move you. I'm going to try to pull you out. Okay? Ready? Here we go. And relax. Now if he let go, I'd go flying. So I'm really I have a staggered stance, and I'm using my body weight to help me pull back so that it's not all my arm that's doing the pulling back. Okay? Now for the sternal portion, we're back at that 135 position. So what I want you to do is pretend that you have a sword on your side, and you're going to pull it up and go, aha! All right? Sound effect and all. Good job. Okay? So now what we're going to do is he's going to hold his arm in that position, but I'm going to resist against that oblique angle. Okay? Now, you can do it one of 2 ways. You want to stabilize that opposite hip from coming up. So hold it there. Don't let me push it down. So you can do it this way. And relax. Or you can be here. Okay, now I'm gonna push you up. Don't let me push you up, okay? And relax, okay? The first way is better for me because of my elbow, but the second way may be better for some of you. All right? Now, the sternal portion, that's a weird angle. That's not a cardinal plane motion, okay? So for that one, there wouldn't be a gravity eliminated position. You would only do clavicular. Is everyone with me? Okay, I know I'm racing through these. The last one that we're gonna do today is pec minor, yeah. So that's gonna be the exact same position that we did for the muscle length testing. Again, I'll go on the other side so you can see. So the patient's just going to have his arm resting on the table. What's the primary action for pec? Minor, sorry, protraction. So what I'd like you to do is just lift your shoulder up like this. There you go. And go ahead and relax. Now I'm gonna have you come up again and now I'm gonna press, okay? Go ahead. And relax. Now what some people will do if they have weak pecs is they will push in with their elbow and push down in the table and using leverage to be able to pull their shoulder up. So what I will do is put my other hand either under their hand or directly under their elbow so that I know that they're not. Okay? So go ahead and pull up again. Hold it there. Don't push it down. And now I can tell that the rest of his arm is not adding to that. Okay? What would be gravity eliminated for pec minor? Sitting, right? So I know I just went through fast. Remember, serratus anterior is this one. Coracobrachialis, this one. And then the pecs. So you're going to be here, pushing across, doing the sword, and then doing pec minor. Okay? So we have 5 more minutes.